Hello, everyone, and welcome to the webinar on COVID-19 pandemic, disability issues in the EU. I hope that everyone is well and safe in these difficult times, and I'm very happy to see such a great interest of all of you for this webinar. We are very sorry for the last minute change of the platform as we run into some technical issues with the other platform. We deeply apologize for this scrambling of new registrations. I will be the moderator today, and as such, I will start by giving some logistical instructions and to present now the order of speaking. So you can find the access to the real-time captioning on the chat, which should appear on the right side of your screen. And there you can follow to an external link that will have the real-time captioning. The webinar will also have international sign language interpretation, as you can see now on your screen. And all participants have muted microphones. EDF is controlling permissions to mute and unmute. So don't worry if when you want to speak on the open floor, you're trying to unmute yourself and you cannot. We will give this permission to you. For the open floor part, where some of you are already registered, I will mention your name. And my colleague Raquel will unmute you, and then we'll be able to start speaking. In case you face any technical issues, you can ask my colleague Raquel through the chat box from now on. So just to be clear, there are two different boxes in GoToWebinar, a question box that you can see on your right side, and normally below that's the chat box. In that one, you can put all your technical difficulties, and my colleague Raquel will answer them. I'm adding now the names of the speakers for the open floor time in the chat box. So you should be able to see them in one moment. You should be able to see them now. If you wish to speak and you didn't register, you can always send us also a message in the chat box and we will add you if we have time. Due to the great interest and the fact that we only have 2 hours, we have indeed some not very tight time. If you have any other, we also already received some questions, which I will present at the end. But if you have any other questions, please feel free to ask them in the question box. This is one above the chat box. The webinar will also be recorded and we'll share the video with subtitles afterwards with all participants. So this is for the housekeeping. Now I just will give a brief outline of our session, and then I will give the floor to our speakers. We'll first have an opening from Yannis Vardakastanis, our president. Then both Catherine and myself will briefly share our work and the main issues that have been common across Europe regarding the pandemic. Then we will hear from the members from the two most affected countries in Europe, Italy and Spain, and this should last around 20 minutes. Then we'll have an open floor space for the members to share, and members will have 3 minutes to share each person. We do apologize if we are not able to give the floor to everyone, but as I said, we have a lot of interest and limited time. Finally, we'll have a brief space for questions, which you can add from now on the chat box. I will now give the floor to Yannis Vardakastanis for the opening.
Thank you, André. I would like to welcome all of you to this quite interesting and important webinar. I hope all of you, your families, your beloved ones, your colleagues, our colleagues, are safe, healthy, and well. All of us have been following what is happening in all member states of the European Union and in fact around the planet. Definitely we live through a very difficult period of our recent human history. Systems, socioeconomic, political systems, health systems are all in difficulty. There is no question in my mind that when the crisis will be over, we are going to speak before COVID-19 and after, which means that what we are going through now is a very historic period for our societies, our economies, for our lives, for our rights. The discussion we are going to have after this pandemic about the CRPD and the SDGs will not be the same as before, because new parameters already are there that need to be considered. I would like to thank Catherine and the Secretariat for the work they have been doing at the EU level. I have been following this very closely and participating also through EDF. We have, in my opinion, immensely supported the work of the International Disability Alliance, which I follow as member of the Executive Committee as well. Concerning Greece, from the very beginning, we tried to address directly the Prime Minister, the leaders of the political parties in the Parliament, the relevant ministers, the leaders of the regional and local authorities, the trade unions, the church, in order to take measures to protect persons with disabilities, with chronic diseases, and their families. As you know, in Greece, we are doing rather, well, let's say carefully. The situation in many areas that we are concerned, for example, in institutions, I will cross my fingers, no cases so far. In the asylum seekers and refugees, very few cases. In other areas, we have been able to secure the funding for the daycare centers that are closed by the state, like the schools. So they will be continuously funded, even closed. So they will not go bankrupt after they will need to open. We have been able to secure a special vacation period for all parents of children under 15, but exceptionally for parents of persons with disabilities also above 15, for as long as the measures of the lockdown are in implementation. And we have been also able to protect to a good level, I think, those persons with disabilities and chronic diseases who work, and they are in the front line, so to say. So they either go to back office, so they do not deal with the public, or they have special vacation to go home or to work from home. As you know, in Greece, altogether, we have 1,955 cases detected so far. We have 79 people in intensive care units, 89 deaths. So this is the situation. The whole disability movement is mobilized throughout the country. we are doing, as I said, work every day with all the authorities. The situation is under control. But what we are reading, following about Italy, about Spain, France, in the States, in the United States, in the UK, and elsewhere, really puts into question what state parties understand when they sign and they declare that they will implement human rights conventions and protect the rights of all citizens, independently of their disability, age, etc., etc. My last comment is connected with what I said earlier, that the situation will be very different after the pandemic is slowing down, is going to slow down or to stop. And that's why we need, both at national level, our member organizations, but also at the level of European Union EDF and at the international level IDA, we need to start thinking and acting how to influence the recovery plans, that persons with disabilities are not forgotten, are not left behind, and even left out. And EDF already is doing this, and I'm sure this is something we need to intensify, we need to adapt our actions, our programs, etc. There will be big investment plans. Already yesterday, although we should not be absolutely satisfied, but that was a compromise that the Eurogroup ministers made yesterday. But it's a very big package, and other packages will follow certainly in the future. And we need to work, to campaign, to demand very strongly that we are there, that persons with disabilities are there in the next day, in the aftermath of this pandemic, and that we need to be protected as one of the most vulnerable groups in this situation. Thank you very much, and I will listen with tremendous interest what my colleagues will need to say, especially from Italy and Spain and from other participants. Thank you.
Thank you very much, Yannis. I will now pass the floor to Catherine Naughton. We are not turning on cameras to the speakers, just because we had some questions about this. Catherine, the floor is yours.
Can you hear me?
Yes.
Yes. Yes, perfect. I see Lisa. Thank you very much, everyone, for joining this morning. And I wish you all and your families and your networks very well during this time. You can see on the European Disability Forum website, we've tried to make all of the work we're doing very available in the public domain so that you can use everything that you find useful. All of the initiatives that we're taking at the EU level are based on the work that you are doing and the information that you have sent us. And the information has flowed extremely well from you to us throughout this whole period, for which we are really grateful. And it has enabled us to share with the disability movement globally, because of course, Europe and now the US are in a very difficult situation now, and that will continue for, so I would like to just outline the main areas of our work. The first area is human rights monitoring. So we're looking at the violations of the rights of people with disabilities across Europe in all the domains they're happening right now, whether it's in discrimination in the face of health or social care services. We're looking at influencing all of the initiatives that the European Union are taking, and we're trying our best to monitor that very carefully. I would really appreciate whenever any of you have things that you think we need to be aware of that we're not, always feel free to contact us, because all of the institutions are working and we do not always pick up everything. So you will see on our website that we have written firstly to the Commissioner for Equality, who's responsible for disability mainstreaming, and we've asked her to act across all the areas of EU action. That official letter, open letter, was sent on the 13th of March and copied all of the President of the Commission and all of the commissioners responsible for the response. We've written to the Commissioner for Budget, for Health. We have written to the Commissioners for International Cooperation and Humanitarian Action. We are also writing to the Commissioner responsible for refugees. This is not ready yet. It will be shared on the website when it is. And then we are also preparing, as Yannis mentioned, an open letter to the heads of institutions and member states on the economic recovery. This is currently being reviewed by the board. So we're doing our best across all of these initiatives, and we post the things online when they're ready in case these are useful for you at national member. We're aiming as much as we can to strengthen the response of the disability movement in Europe, and today's webinar is an example of this, but we're trying to share with you every time that somebody sends a request for information, responding as quick as we can, calling on experts where we need to be able to make sure, because many of these things are very unknown to us. So we're trying to help you and all of our members. Some of that, of course, it's about peer learning, because it's only because our members told us immediately the challenges they were facing that we are able to create, the kind of good practice text and responses. So this strengthening of the response of the movement is about peer learning, EDF collecting what we can and sharing what we can. Indeed, we could say strengthening the response globally, because we're also contributing in the task force of the International Disability Alliance. And an example of that is a Facebook Live they ran on Monday, where we had our board member, Louisa from Italy, tell to people how the Italian disability movement, how Italian people with disabilities are affected, to help the other countries prepare. You can see we're doing a range of public communications, which André will tell you about. We're also looking for opportunities to, our international cooperation programs, of course, are adapting. As you know, all of your activities, all of our activities have to change. We're no longer meeting in person. We have to see whether we can use the resources we have that we had foreseen to use in person for other activities. So in international cooperation, Marion and her team are looking at redirecting resources we had planned for some activities to help DPOs in the Global South respond to COVID-19. And we're going to see what we can do across all of our international work with IDA and with the regional DPOs to help the DPOs in the Global South prepare for and survive and protect their people during this pandemic. And then, of course, we have the internal work in EDF. We had to firstly take care of staff, make sure that everyone was safe and well, working from home. We have to deal with all of our donors, make sure that we can manage to keep our income for this year, and change and adjust our work program for this year and next year. And here we've also had a lot of help from the board of EDF, who've been commenting on next year's work program. While we are going to work in detail on this, we know, and you all know, that we don't really know what's going to happen for the rest of the year and next year, and how the whole situation in Europe and the world will change, and the work that we're going to need to do to be able to respond to that. So we have to foresee that our work will not be business as usual. And we will, in terms of this work programming for next year, that will be a decision taken by our annual General Assembly. Finally, you will all have seen that our General Assembly, which we had planned with our members in Croatia, and we had a wonderful program of meetings planned together with our board member Maritza and Soy. We had exchanges with Croatian youth, with women with disabilities. We had training on the Istanbul Convention, a conference on disability assessment. We had a wonderful program that we've had to cancel in terms of the face-to-face meetings in Croatia. We're going to do our annual General Assembly as an online procedure. We're having continuous legal support with everyone will receive amended AGA invitations which describe the email procedure. This was all adopted unanimously by our board. And we will do some of the trainings and seminars online, to which you will all be invited. The AGA business elements will be dealt with via an email written procedure, exceptionally in this case, because we're not able to have the AGA within the time frame we're supposed to for the Belgian government, which would be before the end of June. So this is the work going on here in EDF at the moment, very briefly.
Thank you very much, Catherine. I will now complement this with the work that is happening in terms of public communication. Before this, I wanted to compliment in terms of housekeeping. I wanted to thank our interpreters, Ferdinand and Lisa, and our live captioner for being here, and also our speakers. I will now share briefly what we are doing in public communication. As Catherine said, we keep a resource list and an article with our member activities in our website, and we have a main document with over 70 demands. These documents with 17 demands are aimed at national governments and at EU leaders, and we did notice that a lot of our members and other disability organizations used it or adapted it for national use, which we really appreciate. In addition, as Catherine said, we sent many letters to commissioners, Commissioner Dalli, Commissioner for Equality, for Health, International Partnerships, and we are keeping the members of the European Parliament, especially the members of the Disability Intergroup, appraised of our work. And we are happy to share that yesterday, Commissioner Dalli, together with Commissioner for Health, Iliadi, and Commissioner Schmidt, the Commissioner for Shops, sent a formal letter to ministers in the EU, where they highlighted many of our issues, especially in regard to medical headlines, as access to healthcare, a situation with lack of support for persons with disabilities, and accessibility of communication. We also produced some more thematic statements, so focusing on the biggest issues. A statement on medical guidelines, which we also collaborated with the International Disability Alliance joint letter to the World Health Organization on the subject, and where we also participated in International Disability Alliance webinar last Monday. We also produced a strong statement on the issue on residential institutions. So as Yannis mentioned before, this is an issue that we see all over Europe. Rates of infection are very high, neglect and abuse, staff shortage are predominant. And in addition, we also talked about this. We also issued a separate statement on community-based services, which also are facing horrible situations and staff shortage. The second statement on community-based support was done together with ENIL and the European Deafblind Union. Finally, yesterday, we coordinated the signature of 45 members of the European Parliament in a letter to the Commission asking for more EU funds to support services. This was coordinated by both us and the SPD. We are working on other topics as well, such as a letter to businesses regarding access and delivery of goods and food, and also on inclusive education. I will just go shortly through the main issues that we see as common trends around Europe. So what we identified that most of you are concerned with. So first, ethical guidelines for triage. I think this is the main concern all over the world right now in terms of deprioritization of patients with disabilities when they need to be treated by for COVID-19. So we saw a lot of guidelines in the UK, in Spain, in Italy that would suggest that patients with disabilities have less of priority to life-saving interventions, and this is not, let's say, very human rights minded. This is not correct. So we are trying to pressure the World Organization, and we are also very happy that this was an issue that was specifically mentioned on the letter of the Commission to ministers. Access to healthcare more generally is also a big problem. In terms of inaccessible healthcare services, non-hygienization of accessible entrances, or not having accessible methods of hygiene like soap or other methods. And then we have also infection and abuse in residential institutions. This main problem, which also happens in healthcare, is a problem with infection is the lack of personal protective equipment, so of masks, gowns that would protect persons with disabilities and their support workers to not infect each other. But also a lot in terms of abuse and neglect. It is very worrying that most countries that are on lockdown instituted an extreme lockdown for institutions where people cannot leave the residential institution by any reason, and that most countries don't count deaths within institutions in official statistics. The fourth issue that I want to mention is the isolation measures that have a disproportional impact on persons with disabilities. We said that governments in countries that impose strict measures have been slow to understand that they are not sustainable for some persons with disabilities. Without fail, all the adaptations that have been done after these draconian measures have been done just because disability organizations complained. So in Spain, Greece, Italy, and France, there are now relaxed measures for persons with disabilities. But they took at times 2 or 3 weeks until they would be implemented. As I mentioned, they don't extend to residential institutions. Lack of access to shops, as I mentioned, is also a big issue that was brought up. Inclusive education, where all authorities have left students with disability behind, or at least almost all cases that we hear, authorities are failing to act. Most actions that we are hearing are coming actually from our members that are acting as a support and filling the gaps. And sorry, just to break the flow, Jean-Pierre, could you mute yourself? I think we are hearing a lot of noise coming from your phone.
Yes, I'm sorry to interrupt, but Giampiero, you need to mute yourself. I sent you a PIN code for your phone, and because otherwise we have a lot of noise.
But I use the telephone. I listen you. You listen me.
Yeah, we can hear you, and we can hear the voices repeated. So I cannot control your microphone. You need to mute yourself or introduce the PIN code I sent you.
I delete the microphone now.
Okay, please do. Thank you.
Thank you very much. I'm very sorry for this. So just to summarize, we went through ethical guidelines for triage, access to healthcare, infection and abuse in residential institutions, lack of support in community-based services, and lack of staff to do community-based support. Isolation measures, which have a disproportional impact on persons with disabilities and an even bigger impact on residential institutions. Lack of access to shops and to food. Inclusive education and lack thereof. As I was saying, a lot of the gaps are being filled by our members and by support services at their own expense. So we are working on, we are exploring cooperation with other human rights organizations to have a position that could alert the local authorities for this. Problems with remote working, especially we are looking in the future when remote working will not be the norm anymore, but many persons with disabilities will still have to stay at home. So we expect that there will be a moment where the average worker will be safe to go back to the office, but that persons with underlying health conditions, persons with certain disabilities, and maybe older persons will still have to stay at home for their own protection. And we need to ensure that businesses and organizations can still ensure the remote access to work, because we see in this moment, we see that remote working is possible from all organizations, so we need to ensure that they continue to do it. I have just two more points. Refugees with disabilities, as was mentioned by Yannis and Catherine. And there are also some issues that we are keeping under watch. The first one is the coming economic crisis and income protection, which will be a whole battle by itself, but also inaccessible forms during lockdown and assistive devices. And as I say this, I do realize I skipped my first point, which is, of course, accessibility of public health communication and of communication in general during this crisis. Here we have a very strong demand on our demand letter. I hope that I was able to touch on all the points. Just to finish also in international cooperation, as Catherine mentioned. And on Monday, you also have Facebook Live by International Disability Alliance next Monday at 6 p.m. Brussels time, where you can also hear from Yannis on this. I will now pass the floor to Ana Pelaz Narvaez, our Vice President, who will talk about the situation in Spain. Ana, can you hear us?
Ana, you need to unmute yourself. You self-muted. Ana, you need to unmute yourself, please. Ana?
Hello.
Hi, Gianpiero. Ana, you need to unmute yourself.
Hi. Yes, because it's down the line.
No, it's okay, Gianpiero, I meet you. Ana, hi, we can hear you now.
Yes, sorry, I don't know what I touched, so I don't know how can I do what you are asking for me. What?
We will maybe pass to Pilar then, as Ana seems to have some issues connecting. So Pilar will talk about also the situation in Spain, and then maybe after Pilar and Jesús Martín, also from our Spanish members, speak, maybe we can hear from Ana to complement. Is this okay?
Yeah, it is okay, but they need to unmute themselves because they muted. You muted yourself, Ana and Pilar. So you need to click on the microphone icon and unmute yourself. Okay, now Pilar, we can hear you. And Ana as well.
Okay, thank you very much. I will make an introduction and afterwards my colleague Jesus will continue some points. First of all, on behalf of CERMI and on behalf of the Spanish Disability Movement, I want to thank EDF for this meeting, and also for everything the European Disability Movement is doing in this crisis and in this health emergency that we really believe, as Yannis told at the beginning, that is a social emergency also. I also want to underline the important role of disability movement at globally considered, not only in Europe but at international level, as agents of social transformation. We have to attend now the very urgent situations in the short time, but also we have to be proactive to rebuild our society in the medium and the long term. Of course, taking always in account that persons with disabilities cannot left behind. Taking always in account the inclusive and human rights-based model that we defend in Spain, in Europe, in all the world, in all the different countries. We would like to share with EDF the good practices we are we are doing now in this crisis. And finally, for the very first of my points, I would like to stress the importance to have a real social Europe now more than ever. Europe must lead this social emergency. For us, it's overall social emergency, and defend persons in a more vulnerable situation. Of course, we are doing this at a national level, but we believe that the European Union must lead also this process. Going very quickly to the most important demands in Spain, we are denouncing the discrimination for disability on the grounds of disability, just when having health attention, accessibility, etc. My colleague will afterwards develop this point. We are also denouncing the situation of persons in institutions, in residential, in centers. We need the attention to these persons must be guaranteed, and is not always or is not guaranteed. We need also specific measures to protect this group in a bigger situation of vulnerability. We also are denouncing the real risk of women and girls with disabilities to suffer violence, sexual violence and domestic violence because of these confinement measures. We also demand civil dialogue. We want to participate proactively in all measures taken by our governments. And finally, we ask for sustainability of the disability movement now and in the very near future. As EDF have done, we also are in permanent contact with our governments and also with international institutions, European institutions, and we have strong alliance with not only EDF but also social NGOs from third sector. I will ask my colleague Jesus to present with more detail another questions, and if we have time after, I can speak again. Thank you very much.
Thank you very much, Pilar. We'll now pass to Jesus.
Jesus, you need to unmute yourself, please. Just click on the microphone icon and we will be able to hear you.
Hello?
Okay, yes, now we can hear you.
Okay, could you hear me?
Yes, we can hear you very well.
I wish you and your families and friends are very well in that critical situation. As you know, this pandemic is a test for societies, governments, communities, and individuals. It is a time of solidarity and cooperation to tackle the virus and to mitigate the effects, often unintended, of measures designed to halt the spread of the COVID-19. Well, as you explained before me, this pandemic is assuming a disproportionate impact on persons with disabilities and our families as well. And as Pilar explained, in the case of Spain, the proactive action of civil society on disability embodied in the case of Spain on CERMI is making it possible to identify and denounce the most obvious discrimination of this health crisis in this group. as well as cooperating with public administration to mitigate the effects of this public health crisis. I related the main discriminations or lack we are identified during this crisis. First of all, in the first moment regarding accessibility, the first moment of the crisis in Spain, none of the appearances of public health spokespersons and roles were accessible for deaf and hard of hearing persons. Situation that disability organizations themselves have to supply by disseminating accessible videos on their social networks. Currently, the active complaint of CERMI has made it possible to solve it. No measures have been taken either cognitive accessibility, such as easy reading and pictograms that favor the knowledge of disease measured to persons with intellectual and developmental disabilities. And in this case, again, the Organization of Intellectual and Developmental Disabilities that are assuming this function. Indeed, in accessibility measures, no has been guaranteed that the telephone care and advice system of health institutions are equally accessible. There are an context and a right where CERMI are very concerned. I'm talking about right to life. Scientists, societies, publish a very worried, a very dangerous document and protocol have found that don't respond to the human rights mandates, not to discriminate or treat unequally, and to act without prejudice and bias that punish those who consider themselves different and therefore less value, whose health and whose life is sacrificed for gains or less priority. These tests give rise to saying persons with disabilities are disposable in critical situations in the health systems. We think you cannot prioritize lives over others at the risk of a health collapse. CERMI has denounced these documents to the health authority, to the state prosecutors, and the Ombudsman and the Bioethics Committee of Spain. In connection with this right, we are concerned as well to right to the health. Furthermore, many persons with disability have a weaker health and therefore are more exposed at a great risk from this infection. That's why they need greater health supervision, and in no case can they be deprioritized due to their disability. To ensure the human rights to health of persons with disability, CERMI has required to health and social authorities and the state and regional level to prioritize the application of rapid diagnostic tests to people with disability who reside in collective institutions, as well as the workers who support and care for them as target population at extreme risks. It also has requests that receipt tests be extended to persons with disability who live in their homes as well, who do to their great needs for support, and in this critical moment, receive support for personal assistance and other direct social care professionals, as well as their same workers. In the area of lockdown, when Spain declared the state of alarm, led the Spain people to the confinement measure to stop the pandemic. However, certain persons with disability cannot, for therapeutic reasons associated with their disabilities, remain indefinitely confined and in their homes. They need to access the public highway to avoid episodes of personal collapse with serious damage to their behavior, their health condition, and their psychological and emotional well-being, such as persons with intellectual development disability, autism spectrum disorder, Asperger's syndrome, and mental illness and other similar effects. CERMI get to change this situation, and the government of Spain accepted our request and published a special instruction to establish interpretive criteria and these cases to establish that it is understood a need for those with disability or illness that for therapeutic reasons associated with this situation require leaving your home daily for a time and going to a street as a therapeutic indication in their lives. However, once the administrative legal issue has been resolved, the civic issue is pending nowadays, because now these persons or their companions, their families, are insulted by some person when they see them on the street for a strictly therapeutic reason. We are identified lacks as well in education right. The suspension of face-to-face school activity due to the coronavirus pandemic has led the Ministry of Education in Spain to publish educational content of children in the public TV. Their contents, again, are not accessible for students with disability. And in Spain, the autonomous community, the regions, are directly responsible in Spain for education. They have launched telematic educational platforms which do not conceive accessibility, so that students with disability who are home can have guaranteed right to education during the lockdown. This lack of accessibility in education compromises this human right of persons with disability during the state of alarm. The right to work are compromised as well, because the economic projections indicate that the coronavirus health crisis will result in an important economic crisis, which primarily affect people with disability, with fewer job opportunities and with more precarious employment contracts. This situation will destroy employment of persons with disability, reduce their opportunities to access employment, and affect saturated employment space such as special saturated employment center affected by massive layoffs and with less demand for production. In the case of institution or residential space and support staff, in Spain, there are many persons with disability who live institutionalized either in residence or supervised flats. However, they have been their last to apply disinfection protocols or to provide protective material to this residential space. As well, the health of professionals working to guarantee the autonomy of persons with disability, such as personal assistants, mediators, interpretive guides, and sign language interpreters, is also not being addressed. In the chapter of social protection, you know, persons with disability or in situation of dependency and our families must continue to be cared during a state of alarm. Many persons with disability require the help and the collaboration of a third person to be able to carry out the basic activities of daily life of development of their personal autonomy. No measures in this case have been planned to alleviate the foreseeable situation of economic vulnerability and employment, which will affect persons with disability and our families in a more virulent way. I want to talk to complement the speech Pilar said for me regarding sustainability of disability organization. In Spain, the social disability movement, in addition to defending the rights of persons with disability and our families, assumed the creation and management of services and programs to support inclusion. This situation can or could suspend tremendously weaken this care, intervention, employment, or educational services, which depend on public or private funds, or what is most serious, the proper sustainability or disease organization. The CERMI or the Human Rights Delegation, depends of CERMI, we work in different ways. We do two very important documents. First of all, we do a compendium of recommendation for the short-term management of the pandemic. And we do as well an emergency operational document for all our organization, for organization CERMI, on adequate healthcare without discrimination on the grounds of disability in coronavirus crisis. We are checking, we are supervising, we are in permanent contact with our organizations to complain and to claim on the rights of people with disability in this critical crisis. We supervise especially the right to life on persons with disability, and we are to our disposal to share our knowledge regarding this tremendous crisis to improve and to protect our weakened rights. Thank you very much.
Thank you very much, Jesus. We will now pass for our members from Italy. We will start with Luisa Fazi.
Okay, can you hear me?
Very well, thank you, Luisa.
Okay, thank you very much. Good morning to everyone, and I want to start by thanking European Disability Forum and its secretariat for this opportunity to keep participation of its member very high, and for me to explain as far as possible the situation in Italy. I share the intervention with Giampiero. I give you a brief framework of the situation, and afterward Giampiero give you the outcome that we try to obtain as a disability movement. So To understand the extent of the problem, you should pay attention to the EV health situation in Italy that given by the exponential increase of contagion and hospitalization in the intensive care units. In 1 month, the number of bed intensive care unit increased by 79%. 300 doctors and 500 nurses were hired only in Lombardy to replace the infected staff or on shift. And each shift means 14 hours and more. The second point is the massive enlargement of the red zone. Now Italy is all red zone. And the lack of attention or inability to pay attention to people in extremely vulnerable condition. Not only disabled people, but also people that have other health conditions. So, regarding the person with disability, after a month of COVID pandemic, the situation of person with disability in Italy is this. Persons with disabilities that are living their independent living project are close at home with a very high risk of contagion for themselves and their assistants. The closure of the daily center obliges the user to stay at home without any alternative care mode. 284,000 pupils and students with disability stay at home without appropriate alternative educational mode. Persons with disabilities living in residential services are confined in these services without any contact outside, and the risk for their health and violation of human rights due the risk of sedation, containment in beds, and limited treatment if not absent. For the residential service for aging people, that means for persons from 65 over, this problem is very dramatic. At last, 3 million families of persons with disability that have one or more of persons with disability affected by this provision for these measures, which means that are families or persons themselves who handle the emergency because receive very little support, if not support from public entities. After a month, what institutional response was? First, confusing and brainwashing legislative provisions. The region did not want to adopt and implement national rules, and this resulting in total abandonment and neglect of persons with disability to their destiny, because the same adopted provision by the state and region are often difficult to apply for persons with disability. No capacity to listen to our requests and suggestions given by DPOs collaboratively. For example, they do not know what it means to hospitalize a person with intellectual disability and uncooperative. So, concluding my speech, after 30 days, we didn't have alternative services to the closure of school and day center have not been activated. In particular, the teachers have turned their backs on their students with disability. Openly and without any hesitation declare, supported by the unions, we must think about our health. We cannot and do not want to think about the health of our pupils with disability. Is terrible, this declaration. The system, school, the system of welfare, the system of health that was supposed to prove the protection of human rights has failed. In this emergency situation, the Ministry of Health doesn't want to hear about disability. The Ministry of Welfare is disappeared. The Ministry of Education forgot about students with disability, and the region, which always claim their autonomy, have failed in their capacity and competence to manage the whole system for which they are and pretend to be responsible. Persons with disability who died do not die because of COVID, but because of incapacity of the system and because were abandoned. We can say we were left behind. We have this year the Italy reviews under the UNCAT, the Convention Against Torture. And we will give to the committee our alternative report, and we will have a lot of things to say about this emergency condition. Thank you for your attention, and I give the floor to Giampiero, if I can.
Thank you, Luisa. Giampiero.
Okay, good morning to all. I hope all of you have the bad effect of the pandemic situation and your family are good. My intervention is writing, so you can find on the website of the EDF. I want to make the reflection in general about the situation. In Italy, there are about 100,000 people affected. This means that 18,000 are died, 29,000 are recovery. This is the official date, but we don't have date on the disability condition. In general, the action that the government do in different legislation proposal is a list of things that you can find in my file. In general, we can say first, we are yet invisible in the sense that to be hearing by the government, to introduce some action, to take in account the rights of persons with disability is a complex thing in epidemic condition. All the action that you can read in my file is related to employment, is related to intervene on the field of the education, or the field of the particular protection of the people at house. But in general, we are very, very not happy about the situation. Italy have a complex institutional framework because the national government not have the power to impose to the regional competency in health and the social services to respect the norms. That means that in any region there are the different application of the different issue. I propose to EDF on this issue to take a particular task force to collect the different actions they are due at national level, yet in epidemic emergency, yet in post-epidemic emergency, because we need to share in particular what kind of solution is possible to developing and what kind of solution is necessary to developing. And that is a first proposal. In particular, yet speaking, Luisa, about education. How is possible to educate at home person with intellectual and development disability? What kind of possibility is possible to use ITC? Very, very, very few. And because it's not in condition to make a personalized project related to the form to use appropriate communication system, that means that this person are abandoned. About the situation in general, the good news that the government today prepare a task force on the field of the second phase of COVID-19 and proposed to me to be part of this group. This means a recognition of the job that the movement do and the exigence to include representative of persons with disability in the expert that moving to planning the future. I want to stress two main issues because I think this is the high level of discrimination and violation of human rights. The first about the system of welfare. In all Europe, the system of welfare take in consideration the vulnerability, the incapacity, the fact that the person with disability are person considered to protect. In reality, the convention say that we are disabled because society. We are vulnerable because society vulnerates us because the person with disability are excluded. The system of protection is not a system of protection. We look in Italy that, for example, the elderly people, they're living in residential long care services. These persons are one of the more affected by the coronavirus infection. The calculation in a research they are due from the National Institute of Health in Italy say that the 37.4% is died for COVID-19 or similar no detected causes because the protection in this residential house are practically no apply until today because there are no the system to protect, no instrument, no form to make exactly the same protection that asking the government to the other population. But the condition in the field of disability is more strong and not yet detected. Because if I look the all two cases that are put on the newspaper, it's a terrible condition. In Sicily, an institution named the Troina Center, they are a high-level scientific research institution, show that on 160 persons with intellectual disability, they are guests in this institution, about 90 or 100 persons are infected. And the management stressed that not have for a long time procedure to protect with the appropriate form the staff and the person living there. In the same time, we are only 3 died declared, the peer person, but I think it's more large situation. The second is another institution that gets 65 persons and they get 78 persons, and on the 78 persons, 65 are infected. For that, we asking to the institution competent, National Institute of Health, to provide a equal research on this condition in this institution. Taking account that this institution have other risks, they are put on evidence by the ombudsman person on the jail and private freedom. This person have stressed different time the problem that exists in this institution for elderly and for persons with disability, and in the same time have stressed the possibility and necessity to make more control because he have the power to intervene, but don't have the power to intervene on the 10, 12,000 centers that get person with disability, elderly people. This is another suggestion that in any country we need to develop a collaboration with the monitor national system that are competent on the basis of the Convention of Torture, because this produces more attention on the field. The second point that for me, the conclusion is that we need to to make a campaign, because this is a good moment to stress that the segregation not favorize the protection. We need to arrive in a welfare that are not a protection only, but a inclusion only. This means the alternative measure related to the person that need particular intensive support. In the other issue is related by the bioethical approach. As you know, in San Marino, the committee of San Marino is the first committee in the world, bioethic committee, that approve an opinion about no use the 3H to violation of human rights of persons with disability in access to health services.
Dear Gianpiero, can I just ask you to finish in 1 minute, as we need to pass to the open floor?
Yes. And for that, I think we need to developing, because at this moment only 10 national bioethic committee have make some action in this field. For that, in my general consideration, I make the attention to involve organization of persons with disability in bioethic. My proposal for the future is pretend to be part of the committee that manage the crisis in any situation of emergency and humanitarian action that stress the United Nations, the EU, and the Council of Europe document. It means EDF needs to be active in this field. At the same time, pretend to create a unit at the European level to monitoring the respect of rights of persons with disability during COVID-19, introduce a discussion with a particular campaign that is not segregation that protects persons, but inclusion, promote a large discussion inside our members on the bioethic activity, and ask it to the DPO at the national level to take part of the discussion in the measure to take in the phase 2 of the COVID-19. Thank you.
Thank you very much, Gianpiero. It was very informative. And now we'll pass to the open floor. I just want to remind the rules before I give the floor to the attendees. We have already a list of people that will speak. You should speak maximum 3 minutes. And we ask you to introduce yourself and your organization before you speak. The first 2 people, Marika Mirikan Golan Kustuda. Marikan Golan, if you are here, can you send us a message in the chat? We don't see your name in the list of attendees, so we will not be able to unmute you. We will start now, then in the third person in order, and then we can give you the floor back if we receive any information from you, Marikan Golan. So I'll give the floor to Marcin Rodzinka.
Thank you very much. I hope you can hear me now. Thank you. I'm Marcin Rodzinka from Mental Health Europe, and I would like to thank EDF for organizing this webinar and giving us a chance to speak and present our statement. I will draw your attention not to a specific country, but rather to a community which faces some specific issues at the moment, and my intervention will be based on a MAG statement released on the 7th of April, so a couple of days ago. Europe now is approaching peak presentations, so the level of anxiety, depression, and stress will likely rise. The need for the professional mental health support can can also severely increase during these times. For example, virus fears have sparked 33% in Irish mental health queries. In the Netherlands, for example, a survey of 1,000 people with mental health problems shows that 50% of them suffer more than usual from anxiety, depression, stress, and insomnia. 1/3 does not know how to get through in the coming period, being afraid that they will no longer receive mental health support, or they feel more than usual lonely. Lockdown and isolation at home make people with mental health problems rely more than ever on support in their families or local communities. And this, of course, can place mounting pressure on family carers. At the same time, isolation also puts women, and that was mentioned already a couple of times today, with psychosocial disabilities at an increased risk of domestic violence. Finally, people living in institutions are at increased risk of abuse or neglect as visits are restricted and supervisions by families or support network are lacking. Coercive measures such as forced placement, treatment, or restraint seem to be on the rise, as they are considered the easy solution due to the staff shortage or disruption of community-based services. Of course, there's no single strategy. There's no single strategy to cope with the current situation. But now more than ever, people with psychosocial disabilities need public policy responses that address their needs for support. And we, as Mental Health Europe, we created a couple of asks, and I will try to very briefly present them to you based on our statement. Two first asks are directed at the national and local authorities, who should, in our opinion, set in place measures allowing for reasonable accommodation of the needs of people with psychosocial disabilities, of course, with their involvement, if possible. National and local authorities must also ensure continued access to psychosocial support. This means providing measures that allow for flexible service provision, peer support, helplines, and online psychosocial support. And the third ask is targeted at the governments that must ensure tools to monitor and address the risk of violence and abuse of people with psychosocial disabilities, including those in institutions. The fourth ask for Mental Health Europe is towards the European leaders, but also national and regional policymakers that should rethink priorities and revisit structural discrimination in mental health care policies to move towards human rights-based approach. And we think that this is a very good moment to come back not to a business as usual. And the last one is the national and European policymakers should really adopt urgent and long-term strategies to mitigate consequences of the current crisis on people with psychosocial disabilities. And I would like to flag one thing to you, just to finish one last sentence, that Mental Health Europe will organize an online meeting exactly on this topic, so how to mitigate the consequences and how to anticipate the aftermath of the crisis and how we can learn and how we can find solutions to this, especially for people with psychosocial disabilities. The date is still to be confirmed, but I will of course disseminate this.
Thank
so
you.
You can participate. Thank you very much.
Thank you very much. I will have to cut you. The next speaker is Sally Vonan-Scalbo. Are you with us? We cannot hear you, Sally.
Can you hear me?
Yes, now perfectly. You have the floor.
I have no microphone. Okay, thank you very much, because my name is Sari.
We cannot hear you anymore, Sally.
Sari Hirvonen-Skarpe. And I am representing Euro-CIU. Do you SCIURO Euro-CIU? I'm representing of the cochlear implant users in the Europe. I'm just following my speech to text writing because I do not hear properly your speech, and I have a big problem to get the picture. So it's coming very slowly, the text. And
Okay.
my question is that how properly all the countries, the inhabitants of the countries have been able to follow the information of the epidemic, the information of this pandemic. I mean, that is very important that all the government broadcasters of television are using the speech to text or subtitles of the language. So all the deaf people or all the people with the hearing loss are able to follow the information because they have a big difficulties to hear or to listen. So that is always very important that you get all information on television broadcasts, that they are always with subtitles. So that is my main information from the association of the people with who cannot hear very well. They are using the cochlear implant. And myself, I am working with elder people homes, service center for the elder people. And the other problem is that when the people are using the masks, like I have to do, and all my colleagues are doing, so how you are able to read the lips? Because I'm always following the face. I'm doing the lip reading. So when you have a mask, it's like this. So it's very difficult for me to read or to see how the people are talking. I masked myself, but I cannot have found it. But it's always that it's like you putting your like a paper in front of your face or paper of your front of your lips. That is very difficult for me or all the people with the hearing loss to read and to listen at the same time, because the voice is not the normal.
Thank you, Sally.
Behind the mask.
We will have to pass to another person.
And the people are able to having the mask which are seen through, that there's some plastic or something that you are able to read also the lips. That maybe sounds funny.
Thank you very much, Sari. Yeah. I will have to pass to someone else as we're running out of time. The next speaker is Marcel Bobdelik.
Good morning. I hope that you can hear me.
Yes, we can hear you very well.
Okay, my name is Marcel Bobdelik. I'm representing the European Federation of Hard of Hearing People. I have a little bit the same comment as Sari, that access to information is very important for everyone, but also very important also for people with a disability. For the deaf people, the sign language. For the hard of hearing people, subtitles on television, special when members of the government, the prime minister of another minister give a press conference. But it is also important that there is audio description and also information in easy reading format. And but I will not more repeat what Sari have said about the mask and etc. because there is a big problem in the hospitals, the communication with people with hearing loss. So that is also important to have our attention for that. Another topic what I will go now is access to hearing care. It is very important that in all European member states, and of course also in other countries, there is an access to hearing care. For example, when your hearing aid is broken or your cochlear implant is broken, and then it is very important that you have access to hearing care. And I'm happy that in the most of the European countries there is access to hearing care, but I will call it that it is very important to have it in all our European member states. So please do attention for that, because when the hearing aid is broken or the cochlear implant is broken and there is no possibility to repair it or change it in another one, then there is a bigger lack in communication and information, and that make the isolation and the disinformation bigger and bigger. Thank you, and thank to EDF to organize this interesting webinar. Thank you.
Thank you very much. Next on the list is Tis Ardi. I hope I said the name correctly.
Yes, it's always difficult, my name in English, but I hope everybody can hear me.
Can hear you very well.
Okay, thank you. Thank you first, EDF, for organizing this and for all the good work you do on this on the European level. I'm going to go swiftly through a number of points which are taking place in Holland. And to start with communication, Marcel Bobeldijk already mentioned it. I would say we made a huge improvement on accessible crisis communication. Very, very happy with that, with lots of help from the people from the deaf and bad hearing organizations and the people with lower cognitive level. So that's a thing that we're happy that it really improves. Next point is hospitalization and IC triage. There's much uncertainty with people, like who is going to decide if you are taken into hospital or that you are getting taken into intensive care. And the biggest question is disability or need for daily care and support a criterium for exclusion? That's an uncertainty that lives in Holland. Another one is people who give informal care or respite care. There's an enormous lack of protective equipment, which makes that it's very difficult to give enough care, and it also brings in very unsafe situations. We think as well that also the lack of protective equipment is one of the reasons why of the bad effect of a lockdown for people who are staying at home and being taken care of, or who live in institutions or in assisted living. So we urge on the government to also see that protective equipment is delivered there and tests so that people can take care for each other and not infect each other constantly. We think with that as well that the situation in Holland is going. There's a fragile improvement in the results of the lockdown for now, but we think that because of the lack of tests and protective equipment, that it might outburst again. So that's a big worry for us. What was also earlier mentioned, all sorts of therapy have been cancelled. That has a huge impact on the health and condition of people who depend on it, both physical and psychical. The accessibility of public and commercial services, work, education, information is often not very well. So that means that many people are excluded from this. And the last point, there's in Holland we have a short-term needed urgency for reliable data on the disability sector in order to monitor the situation and also the number of infections. We don't have a clue at the moment on numbers and on the situation. So that was the last point. I hope this is all a bit clear. Thanks for your attention.
Thank you very much. We now go to Buha Kadriwa and Shepra Nesiri. I think I didn't say your names correctly. I'm sorry.
Hi, André. Buhari is not here. I saw him before, I think, and Shepresa is here. Maybe you can update us. You are unmuted. You can speak. Hi, Shepresa. Yeah.
Hi, I'm here. I'm just waiting for Buyar to connect his microphone.
Microphone and also to log in again because I cannot see him on the participants. Sorry, I saw him during the whole webinar, but not here anymore.
Just a second, please.
Okay, maybe we can give André the floor to Movin.
Yes, we can give the floor first to Anna Pelaez, which didn't have a chance to speak before. I don't know, Anna, if you want to add something to the situation in Spain. Okay, Anna, we cannot hear you. You are still muted.
Hello, André. Can you hear me?
Yes, now perfectly.
Okay, thank you very much. Yes, I would like to give some information also about the situation in Spain. In Spain, for the moment, we have 400,000 deaths, around more or less 52,000 recovered, and more or less about 152,000 people infected. The fact is that these data are just the official data. And yes, as it was mentioned, the problem is that the data comes from just the people who are already checked with the official exam for coronavirus. But we know there are many other people affected behind all this data. So now, which is really very important, and Thelmy is asking about that in our country, is to ensure that disability indicator must be considered in the whole official statistics and data. This is really from our side fundamental. Also, I would like to highlight that Thelmy was asking for international help in the case of our country. We were trying to connect with the World Health Organization trying to avoid the discrimination in the 3 age. We have, for example, regional governments who are not allow people with some kind of disabilities to go to the hospital. That's happened in our country. In our country, happened also that some regional governments cannot accept in hospital people over than 80 years old. So that means the discrimination for our people is huge. But apart from that, what happened is that because many professionals are also affected and they don't have any kind of protection, many people living in institutions are not properly attended, considered, protected, because not because they have the coronavirus, just because they don't have anyone to come to there and to assist them. So this is really very, very complex. Now, for example, in relation with violence, my colleague Pilar was telling you a little about that. The problem is that the government has already mobilized some economic resources and also, for example, hotels for victims of violence. But because due to the situation that the number of victims is growing and growing every day, but we don't have the possibility to offer any support of our women and girls with disabilities. Sermi Women's Foundation published a guide, and you can we can offer this guide for other countries. A guide just address the issue for women and girls with disabilities, but unfortunately we need to do more on that. This is what I would like to share from my side.
Thank you very much, Anna. We will now give the floor to Maureen as we try to solve the issue with Dennis and with Bouchard. Maureen, the floor is yours. We can.
Thank you. Thank you very much, Andrew. It's Maureen Piggott from Inclusion Europe. I want to say, first of all, thank you to all who have spoken so far and for the way in which the issues of people with intellectual disability have been reflected in the reports from Spain and Italy. Just to pick up on some of the points that have been made, but to emphasize their particular importance for people with intellectual disability. The question of, first of all, getting the right to treatment, which has been a struggle, I think, everywhere. Here in the UK, we had to fight the ethical guidelines that were published and got them revised, but we're still finding that at the level of general practitioners, people are being put under pressure to agree to do not resuscitate notices. And that applies in particular to people with autism and people with intellectual disability. I'm sure to others as well, but people with autism have been singled out very much so. Once you've got the right to treatment, the trouble is still not over, because once an individual either gets into an ambulance or walks into the hospital, they are on their own. And for people who can't communicate clearly or whose decisions are not clear, they are additionally vulnerable in facing every other treatment decision from there onwards. And we really do need to have some kind of communication support or hospitalization support agreed as an exception for people with intellectual disability or autism. And I hear it also from Marcel for some people from the deaf community. And as I say, that should not just be communication support, but also assisted decision making. Education has been a recurring issue, and in particular for children, but of course also for young adults. The access to education is just not there. And in fact, an effort from the education authorities to try to make any provision accessible to people with intellectual disabilities just hasn't been forthcoming. That's something that within Inclusion Europe we're looking at, because we feel that the move to online and distance learning will not be rolled back. That will continue to be a bigger feature of how education is delivered And so we need to take on this issue not only during the crisis, but for after the crisis, to ensure access to learning and the use of technology to support that and to have that in a more accessible way. The question of isolation of people with intellectual disability is also exacerbated by the difficulties with communication that many people have and the difficulties with using communication devices. And so support to people to help with communication is really very badly needed and I think goes unrecognized. Some of our members have been very good at staying in touch, picking up on the theme of you are not alone, with telephone support, proactive telephone support to people living on their own or to families to ensure that they are not left out. And I think that's something if all associations could pick it up would be a practical help to people. The issues that families face, particularly families living in congested living accommodation and caring for someone who's dependent on them, as well as maybe elderly relatives. And I think family support is not being forthcoming or recognized as something that's needed during this crisis. And then people who live more independently, the lack of protection for them in their own homes, and also for the people providing support and the replacement of supporters who become ill. The coordination of that support is often lacking.
Marvin, I'm
the person themselves might have difficulty with managing and recognizing where they need to fill gaps in their own support.
Thank you, Marine. I'm sorry, but can you...
Sure, understand.
Shortly?
Sure. So just if you have good examples of people providing support or of the issues, please can you also let Inclusion Europe know. We're trying to keep tabs on the website and to make resources available to people. Thank you very much.
Thank you very much, Maureen. I want to check if Bouchard and Pereza are already available to speak.
Hi, Spencer is there, but Boyar is not here. So we need to wait a little bit. They're trying to fix it. Sorry.
Spreza, would you be able to give the update alone? I'm just 15 minutes webinar, and we do have a lot of questions.
Hi, Andrew. Can you please give us 1 more minute? We are just trying to reconnect again. 1 more minute, please.
Okay. What we will do then, I will pass to the questions that we have, and Schreps and Bouchard, when we see that we have you, please make a signal and we can close the webinar with your input. Is this okay?
André, 1 second. 1 second, please, because I think I got. Okay.
I'm very sorry,
maybe it's okay. Maybe Boyar, if you're under another name, just try to send us a message on the question box. Well, okay, I should see him now. 1 second, sorry. 1 second. No, sorry, still he's not. Maybe he registered under another name, but we don't see him on the participants list. Sorry, he's not here, no. Okay, I think you can go to the questions and I will try to solve this quickly, André.
Yes, so we received a number of questions, both in the webinar and in the before the webinar was registered. Before speaking about the questions, we just have a request from one of the attendees to speak to briefly mention a project Proactive, who is an Horizon 2020 project and is looking for a civil society advisory board for members representing persons with disabilities for their civil society board. We will send this information in to the attendees after the webinar is done. So I'll start with the question, and we have around 10 minutes. So I will not be able to reach all the questions. The first question we received was regarding accessibility, and it was regarding the advocacy of I'm restarting again. So the first question is, what is being suggested to be done when persons with intellectual disabilities, potential those with challenging behavior, are asked to stay quarantined, and because of their mental health, they would be required to at least go out once in a while to change the environment? I think this question was already answered by speakers in terms of the work that has been done in many countries for relaxation of the measures. So I don't know if our colleagues from Spain or Italy want to add something, Anna or Luisa maybe. Otherwise, we'll pass to the next question. And just to summarize what has been done in terms of the organizations of persons with disabilities, it was indeed a lot of advocacy from part of national councils and organizations representing persons with intellectual disabilities. If you do have something to complement, please send it to the chat. And I will.
Luisa unmuted herself. Maybe she wants to say something, but Anna and Luisa, you're both muted, so you need to unmute yourself if you want to say anything. Now we can hear you, Luisa.
Can I speak?
Yes.
Okay. I want to share with the Marcel, Bobeldig, and Sari with a good practice in Italy, where the organization of persons with deaf disability but not using the sign language, they prepare the label in which explain to this person and for the other how to face this problem. If you want, I can translate this label and send in the EDF website resource.
That would be great indeed, so that then will be available to all attendees to check. The second question, which is a bit more technical, is how do you ensure WCAG, so Web Accessibility Content Guidelines 2.1 compliance in all official apps, outreach material, and other resources developed rapidly to the global emergency? I think this is what we referred in the beginning, that it was what we saw around Europe was that this was not ensured. It was through the disability organizations, so I may give the floor again to Luisa or Gianpiero or Anna. Anna has the mic open, so maybe she wants to complement.
Yes, thank you. Can you hear me?
Yes.
Okay, thank you. Thank you for the question and for the reflection shared here today. Here in Spain, the CERMIS members organizations are working very hard also with their own communities and people with disabilities, trying to ensure, of course, disability. So more and more, for example, we have our members working with in relation to ensure that the accessibility and the message is already passed also for their own communities. This is what we are trying to do. But also CERMI is also trying to ensure that all the information, communication, and so on is in all possible format, accessible format, including, for example, easy reading format for people with intellectual disability, for deaf people, for deaf-blind people, for people with vision impairment, and many other groups of people with disabilities.
Thank you very much. I will now take two more questions, so we have give time to our members from Kosovo Disability Forum to talk. One of the questions that we were asked was what types of precautions should be adopted while caring for people with disabilities to prevent from COVID-19. At European level, we see that the main recommendation is to provide personal protective equipment to support workers, to the support networks of persons with disabilities, and to the persons with disabilities themselves. Would Anna or Luisa or Giampiero like to complement?
If I can.
Yes, please.
Yes. Okay. This is a big problem, the problem of personal protective equipment, because in Italy, but I think that in all Europe, this item were not produced in Europe. We are depending from Asia, China, Vietnam. So in this first time, we have not protective item. And the available protective devices were sent also to the health staff. And the item that we have, we buy for ourselves with a lot of difficulty, because the government require, I don't know what the name, obtain for itself the protective item coming from the abroad, and is only now that there are the deaths in the elderly people residential health care that the health authority accept to give this item to the person with disability, user of residential services. For the home and for the other services, there is not still this protective item.
Thank you, Luisa. We will
Can
now.
Can I say something?
Yes.
Thank you. In Spain, thanks to the intervention of CERMI, what we have now is the possibility for our organization of people with disability to use their own annual budget to buy all these devices for their own people. So this was a negotiation made by CERMI to the central government to ensure the use of the budget receiving for our organization from the government, to use it for this device and the protection of people with disabilities. And I think this is a very good practice.
Thank you very much, Anna.
I can speak.
I'm sorry, but we need to give the floor now to Bushal and to the Kosovo Disability Forum. I'm sorry, Giampiero, but we are running out of time. Is it okay? So we will.
Upon the George press better.
Oh.
Upon the George, yes.
Hello.
Hello, we can hear you.
Okay.
Përshëndetje.
Hello.
Fillimisht më lejoni që përshëndes edhe të falenderoj EDF-in për mundësinë që e ka kriju për në mes kësaj lidhje online.
First, I want to thank EDF for providing us this opportunity to have this online meeting.
Nderuar President.
Your Honorable President.
Nderuar Katarina, të nderuar kolegë.
Dear Katarina and dear colleagues.
Duke kuptu rëndësinë, duke kuptu situatën emergjente që gjejmë me lidhje me COVID-19.
Given the situation we are facing due to the COVID-19.
Është jashtëzakonisht e rëndësishme që sot ne të jemi unik dhe të shkojmë të bëjmë diçka konkrete në relacion me situatë.
It is very important for us DPOs to be today unique and to do something concrete regarding this situation.
Vendi nga vion.
The place where I come from.
Aktualisht ka rreth 227 persona të prekur me COVID-19.
Currently, there are around 227 persons infected by the virus.
Dhe fatmirësisht nuk kemi informacione që do një person më akuzuar është i prekur me këtë pandemi.
Fortunately, to the date, We have no information that any of this number is a person with disabilities.
Organizatat anëtare të forumit kosovar të asisë kufizume
The Kosovo Disability Forum
janë mobilizuar që t'japin informata të rëndësishme për personat mas kufizume.
and its member organizations are mobilized to provide necessary informations for persons with disabilities.
Tashmë veç kem disa platforma online që veç do të funksionojnë prej javës së ardhshme.
Now we already have some online platforms and we are due to start working on them from next week.
Kjo është të koordinuar në proces pilot me zyrën e UNICEF-it në Kosovë dhe Ministrinë e Arsimit.
We are going to run some activities in cooperation with UNICEF Kosovo and the Ministry of Education in Kosovo.
Dhe konsideroj që do të mundohemi që ato zbrasinat ku aktualisht kanë fëmijë të mas kufizuar, dhe personat mas kufizuar përgjithësi.
And we are trying to fill the gaps that children with disabilities and in general persons with disabilities face in Kosovo.
Para se mi hiq këta kem,
Before starting this webinar,
morën informacion nga qeveria e Kosovës
I got an information from the Kosovo government
që në përfshin e pak urgjente fëmijët prej 9 deri moshën 18 vjeçar, fëmijët mas kufizuar.
that in the financial emergency scheme are included also children with disabilities from 1 till 18 years old.
Dhe konsideroj që kjo është një informat e mirë.
And I consider that this is a very good information.
Gjatë diskutimit presidentit kuptova
During the speech of the president of EDF,
dhe mendoj që fjalimi i tij ishte shumë përballësor dhe konsideroj që ne duhet të mobilizohemi pas pandemisë dhe më të mirë me pasojat e saj.
I entirely agree with his speech, and I think that we should be united and work together even when this pandemic is over.
Duke kuptuar që në shumicën e shteteve të Bashkimit Evropian situata e personave mas kufizuar është jashtëzakonisht shqetësuese në këtë kohë.
Given that in many European Union countries, the situation of persons with disabilities is extremely drastic.
Unë mendoj që përfaqësuesi nga Italia ku e tha që kemi një komitet emergjent lidhur me menaxhimin e situatës, apo thjesht me shkrimim e informacion është jashtëzakonisht e rëndësishme këtë fazë.
But I am really glad I was really glad to hear that in Italy, a person with disabilities was going to represent in a committee the entire persons with disabilities.
Unë kam dy propozime.
I have two proposals.
Propozimi i është që ne të shkëmbejmë informacione, të cilat lidhen me praktikat e mira të shteteve ndryshme dhe të mundohemi që të njëjtat, domethënë varësisht pjesë mundësive që cilat kanë shtetet të zbatojmë.
So my first proposal is I think that we should be in touch and that we should exchange information and to hear about the good practices if there is any good practice in any European country.
Dhe propozimi i dytë është që të analizojmë situatën çka pas pandemisë, duke marrë parasysh sfidat që do të jenë të ardhmen.
And my second proposal is that I consider we should analyze the situation, how it's going to be after this pandemic is over. We should think what kind of action we should undertake.
Mendoj që dyat propozimet.
I consider that both of these proposals
duhet të analizohen.
Should be analyzed.
Dhe të marrim një aksion konkret të përbashkët unik.
And we should take a concrete unique action, common action.
Pasi që pandemia nuk zgjedh shtet apo religion apo komb.
Because this virus is not choosing a particular state or a particular nationality.
Unë kuptoj që shtetet e Bashkimit Evropian, shtetet ndryshme të botës kanë specifika të veçanta.
I do understand that countries of European Union and world countries in general, they have their own problems and their own specificities.
Por kuptoj që problemet që lidhen me personat me akuzuar janë të njëjta.
But I think that problems which are related to the persons with disabilities, they are the same.
Do të mundohena që të jam aktiv në këtë drejtim, bashkë me kolegët e mi ndryshëm.
I will try to be as active as I can together with my colleagues.
Dhe ne si rrjeti organizator persona me akuzuar në Kosovë.
And we, as a network of organizations with persons with disabilities in Kosovo,
komplet vëmendjen e kem tek personat me akuzuar.
Our entire attention is at persons with disabilities.
Prandaj shpresoj që pas kësaj konference,
therefore, I hope that after this webinar, after this conference,
të kem një grup I cili ndoshta do të hartojnë një plan të veprimit duke marrë parasysh edhe specifikat e shteteve, por edhe duke marrë parasysh nevojat emergjente të persona me akuzuar.
I hope that after this webinar, a group will be established to draft one operational plan by having into consideration both the problems that persons with disabilities face and also by taking into considerations the problems that countries have regarding the situation of persons with disabilities. I really appreciate your time.
Ne vlerësoj lart gjithë angazhimin e juaj në këtë fushë.
And I extremely appreciate your engagement in this field.
Në asnjë mënyrë nuk do të dorëzohemi.
We will not give up.
Dhe do të jem të fortë dhe të qëndrojmë se do të kalojmë çdo sfidë nëse veç jep unik.
And we should try to stay united and strong because like this we are going to overcome this situation.
Thank you very much.
Thank you.
Thank you very much. I'm sorry that we'll not be able to reach the other questions. However, we'll collect all the questions that were asked and we'll try to provide a written answer that will be available for all attendees. I now want to give the floor and to ask Yannis Vardakastanis if you would like to say some closing words.
Thank you, André. I would like to thank all of our colleagues who have taken the floor. I listened very carefully and I was touched very much emotionally by what has been described. There is no question that this situation is one that changes our societies profoundly. And what I would like to say is keep trying, keep fighting, stay healthy, safe, and well. All of us will need to try to bring all the movement together, united. Differences should be put aside. We are all the same before this coronavirus attack, and all need to be there after it is over, more united, more proactive, more decisive, more demanding, that persons with disabilities, with chronic diseases, and our families are not left behind, or even, as I say many times, left out. Because we have been faced with situations that persons with disabilities and persons with chronic diseases have been left out. From EDF, we are going to continue doing our best. But EDF is all of us. EDF in Brussels is just the peak of the pyramid. Now the whole pyramid will need to be active, proactive, and fighting. Stay safe, stay well, stay healthy, yourselves, your family members, your beloved ones, and do your best for our colleagues. Thank you very much. We live through historical times. Thank you.
Thank you very much, Yannis. We will provide a recording of this webinar as soon as possible, and thank you very much for everyone, including speakers, interpreters, and live captioners for joining us.